Sara. Thank you for being here with us. Could you shortly introduce yourself?
Sure. Well, first of all, very nice to speak to you. Thanks for the invitations and welcome everybody in my living room. It's a COVID time, so I'm working at home a lot. So my introduction. Well, my name is Sara Galac. I'm originally from Slovenia. And I have to say I'm a very proud graduate of vet school of the University of Ljubljana. And I live now for about 20 years in the Netherlands. And I work at the Department of Clinical Sciences of the Utrecht University, the Faculty of Vet Medicine. I am clinical endocrinologist and a researcher, meaning I'm a clinical endocrinologist because I mainly see patients with endocrine problems, like dogs and cats. And a researcher because I spend quite a lot of time on research, and I'm interested in everything about adrenal gland, and my topic, I focus on adrenal cancer mainly. So that's briefly what I do.
You're originally from Slovenia and moved to the Netherlands. How did your life road take you there?
Well, it's a long time ago. After my graduation, I was very happy to get a scholarship. I got Tempus scholarship, and I was for externship at Utrecht University. So I spent 6 months here at the same department where I work now. And I kind of fell in love with the working attitude, with the structure, with specialities, with discipline. And I was just graduated, and I really admired the responsibilities the students got at Utrecht University. So I learned a lot, and it was a little bit different that, what we did at vet school in Ljubljana. So then after the 6 months, I went back to Ljubljana and I applied for internship at the Department of Clinical Sciences.
You've worked as a veterinary clinician at the university clinics both in Slovenia and in the Netherlands. Could you briefly compare the countries?
It's my attitude. I'm taking the best of the two worlds. And it's quite difficult to compare. Well, first of all, the clinic in Utrecht is very big. It's much bigger than in Ljubljana, and it has more specialities. And honestly, this was also what triggered me to come here, because I loved endocrinology. I mean, this was my thing. When I learned for the first time about hormones, probably in high school, I fell in love in puzzling who is in fact inducing who, and I loved it. So when I was here for the first time, and I was joining Professor Reimek in endocrine clinics. I mean, endocrine patients all day. That was heaven on earth. Could life be better than that? Could life be better than doing endocrinology all day? So that's one. And in Ljubljana, on the other hand, the clinic was smaller, and we couldn't have specialties. We had general internal medicine. We couldn't do endocrine, nephrology, GI, or something like that.
In Eastern Europe, there is a lack of veterinary specialized educated mentors who would raise the level of veterinary medicine. Many talented young vets go work abroad and rarely come back. Do you have any advice or idea on how to improve the situation?
Yeah, I think it's a difficult question, and I think it's the matter of time that these things will change. I see nowadays a lot of people are going abroad, seeking an education, training possibilities. And what you should remember is, I mean, talking from my personal experience, it's not easy to leave your country, your family, or your friends. But what I can say, it's investment in life. You invest in yourself, you invest in your life, and And I think what is rewarding is that, well, most of the people who leave their country would like to come back. And what I like about my own career is that I love going back. I love teaching at the University of Ljubljana, and we do have a lot of contacts, and I speak there. I'm giving lectures to students once per year, once per 2 years. I love going back to conferences. It's the best place to teach. So what I think, if you will ask me, what do you think that should improve? Well, I think maybe, when people invest in themselves, when they go abroad and when they get education, well, let's call this East Europe, that maybe, people back home should realize how much these, new educated people are worth, and they should be welcomed. Yeah, I'm happy to see it. You see it also on your website, all those scholarships and the trainings, externships, fellowships. I'm happy to see that, because this is how I started as well. You need to have a first impulse.
It seems that university clinics are struggling with strong competition from the private sector, both in dedicated teams and equipment. How do you see the future of university clinics?
I think to me, it's one thing is veterinary medicine is changing. The whole structure is changing, and it's just one way. We have to accept it. We have to accept it's changing. We have to adapt. And sure, I mean, it's not easy, but I'm a believer. I think it's place for both of us. It's place for all of us, meaning it's place for university clinics, but it's also place for private sector. And I can tell you from my own example, I cooperate a lot in the Netherlands or in Europe with people from private clinics, and I'm very happy about it. How do we cooperate? It's like that, it's a busy practice. They see a lot of dogs with adrenal tumors. They see much more dogs with adrenal tumors than I do. And how do we work together is when a dog is operated on adrenal tumor, let's say in Amsterdam or in Belgium or somewhere in Italy, then colleagues would send me tissue material or send me data on the patient with agreement of the owner, of course. And what we do is then we do additional tests on tissue. We provide our results to these private practitioners. And we are also building a large tissue bank. So to me, this is win-win, because being a busy practitioner somewhere in the private practice, it does not give you enough time to do research. And I'm here at the university. I do have time for research, and I need to get financial sources to do reliable research, not just research on my patients, but as big as I can. And this having a large tissue bank gives me all the tools to do research like I want to do. And this is how we find each other. And I think it's just an example. That's how I think that's the future. That's how I think we should work together.
Why do you think international communication, connections, and communities like FECAVA matter?
There are problems in veterinary medicine, like, well, just name it, vaccinations, fair breeding, stuff like that, which you need to address in the whole Europe, otherwise it will not work. And well, COVID-19 rules, for example, there are absolutely some questions in veterinary medicine. I mentioned a few, which have to be addressed trans-European. And maybe one thing more about this. So it's not just about trans-European, not just about caring about animals and rules, but it's also about caring about ourselves. So there's mental issues, and I think it's good. It's good that they're coming up, because veterinary medicine, we are vets, we are very good for our animals, but we have to learn that we have to take care about ourselves as well. So it's good that, well, especially FECAVA is bringing it up, and it's that we talk about it. That's the first step.
Is there something you miss from Slovenia?
Oh, absolutely. Well, you can't look outside. I miss, well, it's yeah, I miss the mountains, of course. Of course. And the clouds are here very low, so I sometimes I live in this imaginary world that behind the clouds there are mountains. Yeah, that's absolutely, that's one thing I really miss. And of course, Slovenian food specialities like pumpkin oil. I think I could show you in my kitchen. We have a lot of pumpkin oil. I'm the biggest importer of pumpkin oil in the Netherlands, and yeah, I love it. And I'm teaching my Dutch friends how to use it, and I'm introducing a Slovene cuisine in the Netherlands.
In the end, do you have any message for young European vets?
Well, my message would be to the vets would be, stay connected, and remember that Europe is a small place. It's really is a small place, and the message would be we have to work and learn together. And for young vets, spread your wings. Go for it. When you think, okay, this is something that I would really like, go for it. I can tell them it will be difficult. You will be missing mountains and pumpkin oil. But it's a life adventure, and at the end, if you can take the best of the two worlds, or three or four, it will make you rich. And that's all what it is about, isn't it?
Thank you so much, and I hope to meet you in person somewhere soon.